Hello to everyone. Firstly, thank you for inviting me to this conference. My name is Cristina Casals. I'm professor at the University of Cádiz in Spain, specifically in the degree of sport science and in the Master of Physical Activity and Health. I'm also member of the MOVIT research group, and in our lines of research, I'm going to present one of them about diabetes. The title of this conference is Exosomes, Exercise and Nutrition in Diabetes, the APETEX project. And why I'm going to present this project? Well, it's a new line of research that we are developing. It has been recently funded by the Spanish Ministry of Science and Innovation. We are going to start next month. We are very, very happy for that. And the duration of the study is going to be 3 years from now. So the full title of this study is Efficacy of a Nutritional Education Strategy and Role of Physical Exercise on the Regulation of Appetite and Body Composition through the profile of exosomes in type 2 diabetics. As you probably know, this is very important because the prevalence of diabetes is very high, and the most important thing is that the prevalence is increasing year by year worldwide. So approximately 500 million people have type 2 diabetes in 2018. But as we have said, this prevalence is increasing year by year. So probably now it has become worse, and maybe with COVID and a reduction in the physical activity, the possibility to go out, and that it can be even worse. In our environment in Cádiz, the prevalence of diabetes is approximately 9%. So is a prevalence quite high, and is an important part of the population. The type 2 diabetes is also called non-insulin dependent or adult onset, and it results from the body's ineffective use of insulin, being the result of excess body weight and physical inactivity. So why is this a problem? Because it's related complications that can lead to heart attack, stroke, blindness, kidney failure, or lower limb amputation. Moreover, diabetes is the seventh leading cause of death by increasing the risk of cardiovascular and other diseases. So I think that is probably the most important is that these deaths or these complications that decrease the quality of life occur very prematurely and are largely preventable through adoption of policies to create supportive environments for healthy lifestyles. So this is known by the population, and accordingly, governments have committed to achieving these goals. Specifically, we have those presented in these slides with, for example, the World Health Organization, and these actions that are proposed with pansocial prevention and effective treatment approaches that are internationally recommended to reduce complication and premature death associated with diabetes, in this case with type 2 diabetes. So although this global report on diabetes and the global plan action on non-communicable diseases establish the need for evaluation of the results of innovative programs that aim to change behaviors, there is a lack of experimental designs focused on these policies. So an important or relevant point is that people knows, at least most of the people knows that they have to eat better, eat healthy, move more. Okay, so they know that they have to improve their diet, and they know that they have to increase their physical activity and exercise. And the researchers also know that, um, governments and that. However, although there are some policies aimed to improve this healthy lifestyle, it's important to highlight that not all education supports behavioral change. So, not all interventions are going to be effective and are going to achieve a real change in the lifestyle of the participants. So, we have to try to educate in an effective way, but this can be sometimes very utopic. So everybody can say we have to do it better, and people have to make a significant change, a significant education, but the ways to do it or development these tools are not so easy. Therefore, we know that intervention should attempt the education achievement in order to improve healthy lifestyle and reduce diabetes prevalence, their complications, and morbid mortality. So in this graphic, we know that there is a high risk according to the body mass index or the fat max. So obesity is a high risk to develop type 2 diabetes. And with this type 2 diabetes, the risks of some comorbidity that we have commented before are increased. So we have to try to obviously prevent here in the early stages, but in this study, we are going to try to improve the health of the participants at this point when they have start with the condition of type 2 diabetics and they have obesity. And we are going to prevent bad development of the illness. We are going to try to control the diabetes, or even if we can have participant in an early stage, it can be reverted and they can be diagnosed without diabetes. It will be excellent. As I have said before, the impact of nutritional counseling on weight reduction and glycemia control and the global improve of health and quality of life in obese and diabetes population have been previously studied, but we have inconsistent results especially when we do a retest, when we evaluate to the population some months after. Okay, so these educational strategies are not so effective as we expected with the research results. So this education strategy should be optimized to achieve behavior change related to nutrition and obviously to physical exercise. So we are going to try to give a new point of view on this way to optimize the education strategies based on nutrition and physical exercise, attending to the profile of some biomarkers, in this case, especially on exosome. So related to the physical activity or physical exercise, most exercise programs to combat obesity have been based primarily on aerobic exercise, because we know that with aerobic exercise we oxidize more fats And we can see a decrease in body fat mass, especially visceral fat mass, increases in insulin sensitivity, lowers baseline glucose and insulin levels. Also, we can see increases in the expression of glucose and fatty acid transport proteins in muscle fibers. So we know that this is a good approachment. And we can see in this graphic that workouts that are performed at the fat max point, that is the info. Okay, when we are at rest, we are achieving our energy from fats. Okay, but when I'm at rest, I'm needing less ATP than when I start to walking or running in a very low intensity, a very low speed. So when the intensity of the exercise starts to increase, the fat oxidation also increase until a point that is called MFO, maximal fat oxidation, MFO. And this point, expressed according to the intensity of the exercise, is the fat max. Okay. If we continue increasing the intensity, for example, if I start to run in a higher speed, this fat oxidation start to decrease because we need the ATP quickly. So we are going, as you probably know, to start to use carbohydrates. So these programs that are focused to train at the fat max intensity seem to reduce body fat and insulin resistance. For example, in a study with older women with type 2 diabetes. However, a problem that we can see with this is that, okay, the research say that this intensity to train is good for their health, is going to improve their health. However, if we can see this, why the people is not practicing more physical exercise or program of physical exercise at the fat max intensity? Well, one thing that usually people say is that they do not have time to practice physical exercise. We know that this is relative, but sometimes when a person is inactive or sedentary, if you say to them that they have to train every day 1 hour, for example, and after that you know that you have to have a shower, or before the training you have to prepare your clothes and that, maybe it's a change in their lifestyle very drastic. So in this line, we also know that we have a lot of benefits. Some studies seems to present that we have even more benefits with high intensity interval training instead of the moderate continuous training. Okay, so this training model has, for example, this great point that it does not need so much time to train. So we can also try to promote the physical exercise with less consuming of like demands of time. And we have shown in our group that a high intensity interval training program can improve insulin sensitivity in people who are overweight or obese. However, there are not so much study comparing both training models in a diabetic population. One thing that is important too is that the combination of physical exercise and nutritional counseling is not to improve the impact on body composition and health in general population and also in type 2 diabetes. However, the adherence of those programs is compromised, and even the complete intervention is performed by the patient, we can find in the literature as we know as non-responders people, okay? So this is also an interesting physiological responders. So we have to focus on these non-responders. Maybe these people can benefit from other physical exercise types or intensities, okay? So there is a scarce in the literature of researchers that compare with optimal design different types of training. So the underlying mechanisms that determine the impact of educational program focused on healthy lifestyle could be explained by molecular and physiological response to the interventions. In this sense, in this study, we have hormones that regulate appetite and exercise. And we think that these biomarkers can give us a little bit or more knowledge to try to study the difference between responders and non-responders to nutritional counseling and to a type of exercise of high intensity or an interval or a moderate intensity and continuous. Okay. So the study of extracellular vesicles and their interaction with physical exercise has been increasing in the recent years, in the last 3-4 years. And exosomes that we have here presented has been now considered as a novel potent vehicles of intercellular communication instead of cell dust as we think some 10 years ago, okay? So exosomes exert the remarkable effects on lipid metabolism, including the synthesis, transportation, and degradation of the lipid. The disorder of lipid metabolism mediated by exosomes leads to the occurrence and progression of diseases. And more importantly, lipid metabolism can also affect the production and secretion of exosomes, as well as the interaction with the recipient cells. Therefore, we think and we are trying to study in this project that the exercise may be applied as effective targets for diagnosis and treatment of diseases, including diabetes. This communication between organs is thus central to the maintenance of glucose homeostasis. Thus, exosomes participate in the development of diabetes and its associated complications. So the study of these parameters can allow us a timely implementation of more personalized therapies. And in these therapies, I'm including the nutritional counseling and the physical exercise intervention. Okay. So moreover, the molecular dissection of the pathways initiated by exosomes under situation of metabolic stress could help to gain a deeper knowledge of the pathophysiology of diabetes and its associated metabolic diseases. So, according to this, exosomes have been proposed as mechanisms for the physiological effects of physical exercise. Most of the exerkines that are the exosome, the exerkines related to physical exercise, okay, are found in the database of extracellular vesicles. In particular, exosomes stand out as new participants in the intercellular communication process that occur in response, for example, to physical exercise. However, we need more studies to clarify these chronic effects of physical exercise, and especially it's important to compare different types of programs and intensity because, in my opinion, we have enough evidence that support that physical exercise is positive for health. However, the research now has a new challenge. we have to try to find the most appropriate type of exercise for each person and each pathology, or in this case, in type 2 diabetes. So I think that is a good point to include at least two types of physical exercise interventions. I would like to include more than two, obviously, but also you know that we have a limited funding number of participants. So one of the great findings in neuroscience is the connection of different biomarkers such as exosomes and the brain on the appetite regulation. And this appetite regulation is directly associated with the weight control. Okay, so if I have a higher appetite and I want to eat more fatty foods or sweeter foods, it's going to be for me more complicated to improve my health and decrease my body fat with the physical exercise intervention or even the nutritional counseling. So these exosomes, as occur with gut microbiota, can have a role in this process of appetite regulation. So in this study, we are going to include it. And thanks to the professor Jesus Gustavo Ponce González, also from the University of Cádiz, is also member of the MOVIT research group. We have also a funded project with this population, as in this one that I'm presented, but in which we are going to measure gut microbiota and we are going to have muscle biopsies to study signaling pathways. So we are going to be able to include all the interesting biomarkers and try to elucidate better these underlying mechanisms in response to physical exercise and nutrition. Related to the EEG, we are going to measure the signal with a food test in which we are going presenting different foods in a screen. So we are going to see this appetite regulation, and despite that EEG is relatively inexpensive, there are no study in this line in diabetics and with physical exercise and nutrition. So our general aim is to determine the efficacy of a nutritional education program and the role of physical exercise type on appetite regulation and its relation with exosome in people with type 2 diabetes mellitus. I think that one important thing is to compare these different types of exercise. So we are going to have 120 participants with type 2 diabetes mellitus and obesity. They are going to be from Cádiz, and they are going to have two possible 12-week interventions. So we are making 6 groups. We have people that are going to have a nutritional counseling and controls that are not going to have any nutritional counseling. And in this condition, it is going to be combined with moderate intensity continuous training, high intensity interval training, or inactive group, okay, like control. So in controls that they are not going to have nutritional counseling, the same. We are going to have a moderate intensity continuous training, high intensity interval training, and the real control group, no, because we have control conditioning diet and inactive group. So we are going to measure dietary intakes with the FFQ questionnaire and 3 dietary recalls of 24 hours, and the adherence to the Mediterranean dietary pattern. We are going also to objectively measure physical activity with accelerometers, self-reported quality of life with the SF36 questionnaire, and some socio-demographic information, okay? So the first day we are going to take blood samples to measure the OMA index, to measure exosomes, and to measure the following appetite hormones, okay? Through ELISA, we have GIP, glucagon-like peptide 1, etc. And we are going to do the tags of emotional reactivity to food images with the EEG test. On the day 2, they are going to come to our physical activity laboratory. So we are going to measure blood pressure, an appetite assessment scale, a visual analogic scale with different appetite items before and after the exercise. We are going to measure body composition in a bioimpedance, basal metabolism, rest on a supine position during 30 minutes with a gas analyzer. Okay, we are going to use the resting fat oxidation calculated by the Frying equation. After that, the participant is going with the mask for the gas analyzer and a polar to measure heart rate, is going to start pedaling on a cycloergometer to determine the MFO, okay, the fat max point. So they are going to perform an incremental test of 3 minutes with 15 BTUs because they are obese people. So this is the protocol adapted, the adapted protocol. Sorry. And when these were rare is over 1, the MFO determination stop. They can rest during 5 minutes. We have to note that this is a low intensity, okay, it's not very high. And after that, they are going to start the maximal VO2 max determined test with increments of 1 minute, okay, and also with 15 BTUs. The nutritional education program is going to be every 2 weeks for 12 consecutive weeks with 20 minutes of counseling session by an experienced nutritionist. And we are going to focus on Mediterranean diet, prebiotics and probiotics, okay, with an individualized analysis of their diet. The physical exercise program, as we have said, we have 3 sessions per week in a cycloergometer with 1 or 2 days off between sessions during 12 weeks under the supervision of a graduate in sports science. We have the HIIT training program and the MICT training program. Okay, so you can see the protocol in these slides. We have the post-test phase. We are going to use in this post-test phase, we are going to measure the same variables I have explained in the pre-test, okay? And we are going to use the Faculty of Sports Science and also the hospital device to measure blood samples, microbiota, and the muscle biopsies. You can see here the reference usage. Thank you for your attention. If you have any questions, any comments you want to interchange, you can freely send me an email. Okay, so thank you very much.